Louise and I work in the Insomnia Clinic at the Royal Surrey County Hospital, and I'm really delighted that you're here with me at the moment to go through the Better Sleep programme. We often do workshops with our patients, so we get them along for an entire day and we teach them all the tools and advice they're going to need to have a really positive impact on their sleep. We know though for some of you, getting to workshops is really difficult, taking time off work can be difficult, or you may have other reasons. So we have developed these Better Sleep treatment videos so that you can get everything you need to be able to improve your sleep right in your own home. So we're going to take you through the Better Sleep programme. This is a programme that we've developed at the Royal Surrey for treating people with insomnia. Better is actually an acronym, B being basics. This is the basics of sleep, insomnia, and your insomnia treatment. E is embracing change. This is all about learning to relate to sleep in a new way. T is training the brain. We want to train your brain to reset for better sleep. Your second T is taming the mind. This is all about calming that busy mind, reducing arousal and coping with stress. E is for energize. This is all about how to optimize your energy and live a more fulfilling life. And finally, R is relapse prevention. This is being able to maintain progress for years to come. In these videos, I'm going to run through the first 5 of the letters, the B, E, T, T, E. This will be in 5 videos, which are around 20 to 30 minutes of length. It will be really helpful for you to watch those videos in order, but you can choose to watch them all in one day, or it might be that actually you prefer to watch one week and one the next week. That's absolutely fine too. And I want you to know that this isn't your entire treatment. Actually, we really want to carry on working with you after these videos. So if there's anything you haven't understood, then please contact us. Email's the best way. And hopefully everything will be going really well after these videos. Even still though, we do want to see you for at least one last appointment. We want to go through the final R for relapse prevention, but also we just want to share the joy that you're experiencing in having better sleep. And if you're having any trouble, then we will continue to work with you to troubleshoot that. So we treat insomnia using a treatment called CBT for insomnia. That stands for Cognitive Behavioural Therapy for Insomnia. CBT for insomnia is the gold standard treatment. Years and years of research show us that this is more effective than medication or anything else we've found to treat this. If you've had CBT before and you've not found it particularly effective, and maybe this has been for anxiety or depression, then please don't worry. CBT for sleep is actually very different to treatment for anxiety or depression. CBT for insomnia addresses the thoughts and feelings and behaviours around sleep, some of which we know keep people stuck in a pattern of poor sleep. And by targeting these, we're able to radically change people's sleep. The biggest caveat is that this only works when you do it. We're really lucky. I'm really lucky. I get to sit here and talk you through it, but I don't actually have to do any of the work. The real work comes when you come to put these techniques that I'm about to give you into practice. Please be encouraged though. We find that around 80% of our patients have a really good improvement as a result of going through this programme. So we're going to take just a little bit of time looking at some of the causes of insomnia, because this can be a helpful way of us working out how to deal with it. Insomnia is typically the accumulative impact of 3 main factors. The first factor is predisposing factors. These are the things that make us vulnerable to experiencing insomnia in the first place. Factors such as being a worrier or being a light sleeper. But these factors by themselves do not actually cause the insomnia. Then we have precipitating factors. These are the triggers, the trigger that may have sent you into a period of poor sleep. Now, some people are aware of their trigger and other people are not. If you're one of the latter, then please don't worry. The trigger might be a period of stress, financial difficulties, ill health, anything really. But a trigger is not what causes the insomnia. The trigger disrupts the sleep, but doesn't necessarily cause it to stick around. For that, we have perpetuating factors. These are the factors that are going to mean that instead of your insomnia resolving, actually it stays around. The perpetuating factors are usually changes in how you think about sleep and how you respond to sleep that actually keep it going. A good example might be you have a really bad night's sleep and then you lie in to compensate, which helps you feel better during the day. But in the long run, over a course of time, this actually leads to a lower drive for sleep at night time, meaning that it's harder to sleep. I would say if you're somebody who is continuously seeking to find the solution to your insomnia, then please give yourself permission to let that go. Actually, we can't change anything that's already happened. We can't change what put you at risk of insomnia. We can't change what happened to trigger it. The only thing we can look at now is what's maintaining it and eliminating those factors. And for that, you don't need to know what caused your insomnia in the first place. And essentially, what's really important is not what's happened already, but what you do from now. So the media is paying a lot of attention to sleep at the moment. In fact, it's fairly unmissable. The irony of it is the people that actually need to take some notice and prioritise their sleep probably aren't listening. Yet the people like yourself who are having difficulties with sleeping find this just piles on extra pressure to need to sleep. I want to try and take some of the pain and concern out of that though. What the media and the general public are not aware of is that actually there is a difference between sleep deprivation, which is almost always what they're reporting on, and insomnia. Sleep deprivation is a lack of opportunity to sleep, either because somebody is not spending enough time in bed or because they have something either internal or external disrupting their sleep. This is not the case with insomnia. With insomnia, people have plenty of opportunity to sleep, but their body just doesn't seem to take the opportunity. If we use the metaphor of food, sleep deprivation is a bit like a famine. There's a complete absence of food. Whereas insomnia is a bit more like having a food intolerance, where food is available, but your body doesn't react in the expected way. I say this because in the media, almost all the studies that are reported on are sleep deprivation studies, where somebody has been brought into a laboratory and restricted in their ability to sleep. And this has quite severe consequences. One of them being sleepiness, daytime sleepiness, which as somebody with insomnia, you will probably be aware that actually this is really unusual in people with insomnia. Most people during the day actually feel quite tired, but wired. This is in no way intended to undermine your experience of insomnia. Insomnia is awful at nighttime and it has massive daytime consequences. But I want you to feel reassured that there is actually very little evidence to suggest that insomnia causes all of the devastating health consequences that we hear of. So thinking about things that we've heard in the media and from friends and family and other beliefs about sleep, I would like to give you a few statements, common beliefs about sleep. And I want you to pause for a moment and just think about whether they are true or false. Most sleep disorders eventually go away even without treatment. False. Sleep disturbances that go on for more than 3 weeks typically require the assistance of a professional to resolve them. It is normal to awaken several times a night. True. It is rare for an adult to be able to sleep through the whole night without waking. In fact, using polysomnography, we know that most adults will wake around 10 times per night, but this is so brief that they're not aware of it. Of course, it is a bit different if you're waking and you're awake for more than about 15 minutes. This is a sign of insomnia. Your brain shuts down during sleep. False. The brain doesn't shut down during sleep at all. There are two main types of sleep: REM sleep, rapid eye movement sleep, and non-rapid eye movement sleep. During non-rapid eye movement sleep, we have a further 3 stages. Light sleep, which is stage 1 and 2, and then deep sleep, which is stage 3. This is where most of the restoration to your body occurs during the night. You get more deep sleep at the start of the night, which is why people are often prone to wake more as they come closer to morning. REM sleep is generally about emotional regulation and consolidating memories. You cycle between all of these stages of sleep over the course of the night in round about 90-minute cycles. So for the average sleeper, there may be around 5 cycles of sleep per night. Adults need 8 hours sleep per night. False. There is no definitive number that any adult needs overnight to sleep. I know that 8 hours is often quoted in the media. However, that would be a bit like saying that we all need to be the same height or have the same blood pressure. Yes, there is generally an average, but no specific amount that you must be getting to sleep. What's more important is actually the quality of your sleep. And furthermore, the amount of sleep that you need will change throughout your lifespan and depending on the day that you have had. Essentially, the most crucial thing is that during the day that you feel well and alert most of the time. Tiredness and sleepiness are the same thing. False. In fact, tiredness and sleepiness are different. Tiredness is related to low energy or fatigue, whereas sleepiness is the urge and ability to fall asleep. Many people with insomnia don't feel particularly sleepy during the day. Instead, they report feeling tired but wired. Conversely, if somebody is only permitted to spend a couple of hours in bed, or maybe they have a disorder such as sleep apnea, they are likely to feel highly sleepy during the daytime. Good sleepers sleep well every night. False. No, good sleepers do not sleep well every night. It's completely normal to have the odd bad night. Probably the difference is though that a good sleeper would find this inconvenient and irritating and shrug it off, whereas for someone with insomnia it's a lot easier to get worried about the bad nights. So I hope that's given you some helpful insights into sleep. The reason these are relevant is that if we hold something to be true that isn't the case, or if we have super high expectations about our sleep which isn't based on fact, then actually we're probably going to evaluate our sleep as worse, and then that just puts more pressure on us to be sleeping well. Now that's the end of the first video, the basics of sleep. I hope you now feel that you have a better understanding of sleep, insomnia, how it develops, and the treatment that we're going to take you through. I can't wait to see you on the next video, Embracing Change.